You need to engage about your health. The reality is it can and it will possibly save your life. So how I was diagnosed is actually quite interesting because it happened by accident. I went for a swim with grandson and I felt a sting in my foot and discovered it was a broken wine bottle. And about 4 or 5 days later, it became infected. So as a result, I went to the GPs. I actually hadn't had any tests for 3 years. I said, well, wouldn't it be a really good idea to do the rest as well? Everything came back fine except the PSA was 17. And of course, about 2 months later, I was diagnosed with advanced prostate cancer. I had no idea I had anything. That was part of the confusion about coming to terms with it because there was no effects. There was nothing. You know, even going to the bathroom, there was no effect. There was no pain, no discomfort, nothing that you could visibly look at and say, well, oh, you know, there's something wrong here. But what was clear was that the cancer had spread from the prostate, so surgery was not an option. The options were ADT, which is to deprive the testosterone because the cancer feeds, that's its food, if you like. So they started that immediately and then prescribed radiation therapy to try and shrink the tumours. What it's also done is, in relation to our family, is that it's made us somewhat closer. And particularly with my wife Maggie, because she's been battling with breast cancer. We sometimes jokingly refer to each other as frequent flyers to oncology units. So we make sure that our appointments are on the same day and all those sorts of things. That insecurity, if you like, about, well, are you going to be around next week or next year, or those types of things are somewhat apparent. So you need to, to continue to be working positively forward. In relation to, the not so good stats, if you like, on Māori prostate cancer and outcomes, what it's called is lack of engagement. There are over 500,000 Māori that are registered with GP practices. There's 56,000 Māori that are aged between 45 and 65. We're dealing with a men's disease. We're not so great at engaging about these things with our own families, let alone health practitioners. And this whole thing about the inequity, if you like, is a developmental thing over the years, which not only reflects just in prostate cancer, but it reflects in most diseases. It's got a long way to go, but I think the time for engagement is now.